This week, we will focus solely on our progress against the pandemic, and our progress is both frustrating and frightening.
New modelling today presented a dire prediction of what Ontario is up against from COVID's third wave. With disaster looming, the province has announced a longer shutdown, new restrictions, more rules, more field hospitals, and even with all of that, the fear is it may not be enough. We heard earlier in the program from Dr. Cali Barrett, a critical care specialist with Toronto's University Health Network, and we wanted to check in with her again. Dr. Barrett, first of all, what is happening inside Ontario's ICUs right now?
So we're seeing increasing number of patients presenting to hospitals right now who are critically ill with COVID-19, who need to be admitted. And quite frankly, the ICUs are filling up. There are fewer beds available, and we're having to transport patients from one region to the other to shuffle them around to places where there are beds available and there's space. And we're close to the breaking point.
Every morning we see the new numbers in Ontario of infections. They remain very high, and you know better than I do the time lag between people getting infected and those who will end up in your care, in critical care. Are you worried about the next few weeks?
I'm absolutely terrified. We're predicting between 1,000 to 1,200 patients in Ontario's critical care units with COVID-19 by the end of April. And there's not much we can do to change that at this point. So we say that, those numbers are baked in, but what we can change is what happens, the infections that are potentially transmitted tomorrow. So we can't change anything up until tonight, but tomorrow's infections we can change. And quite frankly, the numbers are catastrophic. It's far more than we have the capacity to care for in our province. And my colleagues and I are really worried about what we're facing.
You're a specialist doctor, a scientist. I know you choose your words carefully when you say things like catastrophic. Do you think there's a danger that Ontario will run out of room in the ICUs?
Yes, I do. I think we're very close to that. And it's much more than just physical space and beds. We'll take the beds, but we don't have enough health care workers to care for those patients. So any given patient in the ICU has many, many, many care providers contributing to their care. And we are already maxed out. We are already struggling to staff our ICUs adequately with nurses. Physicians are being called in from other regions and other jurisdictions to help man the units, essentially. We're already struggling, and we simply cannot continue to sort of flex up. There are limits to how many patients one individual physician and one individual nurse and respiratory therapist can care for at any given time. So no, it's going to get really scary.
You know, those of us who aren't in the medical profession sometimes throw around the word triage, but you actually know what that means. And so once you get to that point, if you get to that point, what happens?
So a triage scenario is our worst nightmare. And it essentially implies that physicians will be deciding among critically ill patients who is going to get the next available bed that is staffed and who isn't. And the people who are triaged to not receive a critical care bed are much more likely to die. And there will be people in a triage scenario who are going to die who, had there been resources available, would have lived. And that is absolutely horrifying. And it is like something out of it's out of a horror movie, quite frankly. And it will be absolutely traumatizing to my colleagues. And I can't imagine the anger I would feel if that was my loved one who got triaged out of an ICU bed because we hadn't done what we needed to do to get this pandemic under control.
You're on a provincial advisory board. You are very aware of the modelling data that has been available to the province. Today, your Premier Ford, said we're losing the battle between variants and vaccines. We're on our heels. As you know, he brought in some new restrictions. But when you hear that rhetoric from the Premier today, what's your reaction?
So look, we all know that vaccines are the way out of this pandemic in the long run. But in the coming weeks, we cannot vaccinate our way out of this third wave. And the only tools in our bucket at this point in time are the public health measures that have worked here in Ontario and elsewhere before. And they're evidence-based and they're science-based. Reduce mobility, reduce contact with other people, adequate ventilation, masks in conjunction with vaccination. And so right now in Ontario, that means we need to close all but essential workplaces. We need to pay for people to stay home from their essential work if they're sick, and we need to protect their jobs while they're away. And we need to be really focused in terms of vaccinating those most at risk.
I know you touched on this, but I do want to ask you directly, how are you and your colleagues doing?
Everyone is doing the very best they can. The fatigue and burnout amongst my colleagues is unreal. And many of my nursing colleagues have quit or moved to other units. It's really dire. It's in one way, we've all come together and there is a sense of camaraderie that was not there before. But on the other hand, nerves are fried and people are tired. And yet we all know what we're coming up against.
Dr. Barrett, thank you very much for sharing your story.
My pleasure. Thank you.